Last year, the Ministry of Health launched the National Cancer Control Strategy 2023 to 2024, a well-thought-out framework anchored on 5 pillars: prevention and early detection, diagnostics, treatment and palliative care, strategic information, and financing. I applaud this strategy. But we must now confront the harder question. Are we implementing this strategy? Are we matching vision with capacity, ambition and accountability? And is our treasury prepared to finance this strategy to the end? Less than 15% of eligible women are screened, and many are diagnosed too late. We therefore resolve to act, and act boldly. Through partnerships with organizations such as KMET, Cure Cervical Cancer, Africa Cancer Foundation, and PEPFAR, we're implementing a community-based screening program targeting every eligible woman in Kisumu within 3 years. We're also addressing prevention. Under the leadership of our county first ladies as champions, we have increased HPV vaccination among girls aged 10 to 14 from 12% in 2022 to 38% in 2024. This has been achieved through community health workers, schools, nurses, and grassroots advocacy, supported by partners like the American Cancer Society and UNICEF. Our efforts are bearing fruit, with LREB counties posting the highest see and treat rates, a testament to what committed advocacy and partnership can deliver. Despite good policy frameworks, we still face implementation bottlenecks. 1, many counties lack essential diagnostic infrastructure. 2, we face an acute shortage of oncology specialists. 3, financial protection remains elusive for many patients and proposals. And lastly, we cannot ignore social and cultural barriers. Fear, stigma, and misinformation continue to hinder early diagnosis and care seeking. Indeed, as I've been told by my friends at Jaramogi Oginga Odinga teaching at Referral Hospitals, people don't want to be told that they have cancer. If you say so, they think you're pronounced a deathbed. But that is not the case. I think more public education will make sure that cancer is treated like any other disease, preventable, curable, and indeed something that should be such a threat to humanity. We must address these issues head-on. Let us not be content with writing strategies. Let us instead commit to funding them, staffing them, equipping them, and measuring their impact. As I close, ladies and gentlemen, let me say that to ensure that policy translates into impact, counties must operationalize the national strategy's pillars, from prevention and screening to diagnostics, treatment and palliative care at every level of the health system. 2, stakeholder coordination must be institutionalized. National government, ministries, county departments, healthcare workers, NGOs, community health volunteers, and development partners must align on plans, funding, and messages. 3, community engagement and demand creation, as we have done in Kisumu, must be at the center, because the greatest interventions fail if people do not trust or understand them. 4, we must invest in surveillance, training, research infrastructure, including national reference laboratory and robust data systems. 5, and lastly, and critically, we must scale up financing mechanisms, including public-private partnerships, domestic resource mobilization, and risk pooling through insurance to cushion Kenyans from catastrophic health expenditure. Let this summit spark a renewed commitment, not just to talk cancer, but to treat it, to prevent it, to fund it, and to eradicate it where we can.